Hey everyone, and welcome back for our deep dive, this time into something kind of mind-blowing. Artificial intelligence in fertility treatments. I mean, we hear so much about AI these days, but how is it actually changing things for patients going through ART? We've got some really interesting research here from a leading fertility conference to dig into.
Yeah. It's funny, when a lot of people think AI in medicine, they jump right to like robot surgeons. But this research really highlights how AI is already making a difference in art in ways that are honestly more about improving the human experience than replacing it.
Okay, so no robot doctors taking over fertility clinics just yet.
Not quite. But think about those early stages of seeking treatment, right? It can be, well, a lot for anyone. And that's one area where AI is already proving super valuable.
Totally. It can be really overwhelming just figuring out where to even start, what questions to ask.
Exactly. And this research really emphasizes how AI can be a game changer when it comes to making information more accessible and reducing that initial anxiety. For example, we're seeing more and more fertility clinics incorporating AI-powered chatbots into their systems.
Like those chatbots you see popping up everywhere online.
Yeah, exactly, but specifically geared towards answering questions about art.
So someone could basically get support 24/7 without having to, actually talk to a person right away if they're not ready.
Absolutely. It's like having a resource available anytime, day or night, to answer those initial questions, provide personalized information, and just kind of help navigate those first steps.
That makes a ton of sense, especially for anyone feeling, I don't know, maybe a little embarrassed or unsure about even asking those questions in the first place.
And the really interesting thing here is it's not about replacing that human connection altogether. It's more about freeing up doctors to really focus on what matters most, the patient themselves.
Because they're not having to spend as much time on those more like logistical or repetitive questions.
Exactly.
So it's almost like AI is taking on some of the more, I guess you could say, administrative or informational tasks,
Yeah.
which then frees up doctors to really be present with their patients.
That's exactly it. And that actually leads to the next thing I wanted to touch on, because this is where it gets, well, I'll be honest, a little sci-fi sounding.
Yeah, bring on the robot overlord.
Yeah, bring on the robot overlords.
Haha, not quite. But the research does talk about using AI to actually read patients' emotions.
Okay, now that is straight out of a movie. Right. It sounds wild. But when you think about it, we're already kind of used to technology picking up on our emotions to some extent.
Like those social media filters that tell you if you're happy or sad.
Exactly. Although obviously this is way more sophisticated.
Right.
What we're talking about here are AI systems that can analyze like really subtle cues in our facial expressions, our tone of voice, even those super quick micro expressions that we might not even be aware of.
So like stuff that even a trained therapist might miss.
Potentially, yes. And the idea is that by picking up on these cues, AI could help doctors better understand how a patient is truly feeling, even if they're trying to mask it.
Okay, I'm trying to wrap my head around that. Like, how would that even work in a real-life situation?
Imagine, for instance, a patient coming in for a follow-up appointment, right? And maybe they're putting on a brave face, saying all the right things, but underneath it all, they're feeling really anxious.
Which happens all the time.
All the time. But an AI system might be able to detect a slight tremor in their voice or a fleeting expression of fear that the doctor might not consciously pick up on. And that could be really valuable information because it could allow the doctor to, maybe adjust their approach, offer more specific support, things like that.
Wow. So in a way, it's almost like having this like extra layer of insight and empathy in the room.
Exactly.
Okay. But I have to ask, doesn't that also feel kind of, I don't know, invasive in a way? Like, are we going to get to a point where we feel like we can't even have our own private emotions in a doctor's office?
That's a totally valid concern. And it's something the research definitely touches on, too, because anytime you're dealing with technology that has the potential to be so, I guess, intimate, it raises a lot of ethical questions.
Yeah. And it gets even more ethically, I don't know, complicated, I guess, when you start talking about what the research calls bespoke parenthood.
Right. It's like now we're not just talking about treating infertility, but actually using AI to shape, well, maybe even design the next generation.
It's like, whoa, are we stepping into some kind of Gattaca territory here?
Well, it definitely raises a ton of questions. The research even uses the phrase made-to-measure parenthood, which, I mean, it makes you think.
Seriously. Yeah. Because the thing is, we're already at a point where AI is being used to analyze huge amounts of data, like genetic information, with this crazy level of precision. So yeah, maybe you could use that to avoid passing down certain genetic conditions.
Which, of course, a lot of people would say is a good thing.
Right, absolutely. But then where do you draw the line? Could you start choosing things like eye color or height? Or like, I don't know, even personality traits? It all starts to feel really ethically murky really fast.
It does, yeah. And that's why, as the research points out, it's so important to have those conversations about, not just what we can do with this technology, but what we should do.
Exactly. Because it's not just about individual choices, right? Like, if these technologies are only available to certain people, what does that mean for society as a whole?
Right. Are we going to end up exacerbating existing inequalities or even like changing the very definition of what we consider normal? These are huge questions.
And I think it's important to acknowledge that there aren't any easy answers here. It's not about being anti-technology or anything like
It's
that.
about being like thoughtfully cautious.
Right, exactly. It's about making sure we're thinking about the potential consequences, both good and bad, before we just kind of like race ahead full speed.
And I think the biggest takeaway from all of this is that the future of AI and RT is not like some predetermined thing. It's something that we are all shaping right now.
By having these very conversations.
Yes. And making our voices heard.
Well, on that note, I want to thank you so much for joining me on this deep dive. It's been thought-provoking, to say the least.
Haha. Yeah, definitely makes you think.
So, to our listeners out there, we'd love to hear your thoughts on all of this. What do you think about the future of AI in family making? It's a complex issue with no easy answers, but one thing's for sure, it's a conversation we need to be having.
Absolutely. And thanks for tuning in to the deep dive, everyone.